Have you ever been told that you need surgery and immediately felt a wave of anxiety? If you're over 60, that's a completely understandable reaction. While modern medicine has made surgery safer than ever before, age can bring unique challenges that increase the risks associated with certain procedures. That doesn't mean seniors should avoid surgery altogether. In many cases, surgery can improve quality of life, relieve pain, and even save lives. However, understanding the potential risks is one of the most important steps you can take before agreeing to any procedure. Doctors often look at factors such as heart health, lung function, kidney function, medications, mobility, and recovery potential when evaluating older patients for surgery. As we age, our bodies may take longer to heal, and complications can become more common. In today's video, we'll discuss 5 surgeries that often carry higher risks after age 60. We'll explain why they're considered riskier, who may be most affected, and what questions you should ask your healthcare team before moving forward. And make sure you stay until the end, because we'll also share several practical steps that may help reduce surgical risks and improve recovery outcomes. Let's get started. Number 5. Spinal fusion surgery. Many seniors experience chronic back pain, spinal stenosis, or degenerative disc disease. For some individuals, spinal fusion surgery may be recommended. This procedure involves permanently connecting 2 or more vertebrae in the spine to improve stability and reduce pain. While spinal fusion can be effective for certain patients, doctors often approach it carefully in older adults. Why? Because recovery can be lengthy and physically demanding. Older patients may already have reduced bone density, muscle weakness, or other medical conditions that can complicate healing. Potential concerns include infection, blood clots, delayed healing, nerve damage, reduced mobility during recovery. Some seniors may also struggle with rehabilitation after surgery, which is an important part of achieving a successful outcome. Before agreeing to spinal fusion, many doctors recommend discussing alternative treatments such as physical therapy, pain management programs, exercise programs, lifestyle modifications, less invasive procedures. Questions to ask your doctor include: is surgery truly necessary? What are the expected benefits? What is the recovery timeline? Are there less invasive options available? Understanding all available options can help you make a more informed decision. Number 4. Major abdominal surgery. Major abdominal surgeries include procedures involving organs such as the intestines, stomach, pancreas, liver, and gallbladder. These operations can be essential and sometimes life-saving. However, they often place significant stress on the body. As we age, our ability to recover from major surgical trauma may decline. Older adults are more likely to have underlying health conditions such as diabetes, heart disease, high blood pressure, kidney disease, lung disease. These conditions can increase the likelihood of complications during and after surgery. Possible risks include infection, pneumonia, blood clots, heart complications, delayed healing. Another challenge is that seniors may experience temporary confusion or delirium after major surgery, especially when general anesthesia is involved. Family members are often surprised when a loved one appears confused or disoriented after an operation. In many cases, this condition improves over time, but it can prolong recovery and require additional care. Doctors often perform extensive pre-surgical evaluations to determine whether a patient is physically prepared for a major abdominal procedure. If surgery is recommended, don't hesitate to ask, what are the risks in my specific case? How long is hospitalization expected to last? What type of support will I need afterward? The more prepared you are, the smoother the recovery process may be. Number 3. Heart bypass surgery. Heart disease remains one of the leading health concerns among older adults. When coronary arteries become severely blocked, doctors may recommend coronary artery bypass graft surgery, commonly known as bypass surgery. This operation can improve blood flow to the heart and may significantly improve survival and quality of life for certain patients. However, it is a major surgical procedure. During bypass surgery, surgeons create new pathways for blood to reach the heart muscle. Because the operation is complex, it carries risks that can increase with age. Potential complications may include stroke, infection, kidney problems, irregular heart rhythms. Bleeding. Older adults often require longer recovery periods compared to younger patients. Some individuals may also experience temporary memory issues or cognitive changes after surgery. This doesn't happen to everyone, but it is a topic worth discussing with your healthcare team. Fortunately, advances in surgical techniques and patient care have improved outcomes dramatically over the years. For many seniors, bypass surgery can provide substantial benefits. The key is understanding your individual risk profile. Important questions include: are there non-surgical treatment options? What benefits can I realistically expect? What is my personal risk level? What will recovery involve? Making an informed decision is critical. Number 2, hip replacement surgery. You might be surprised to see hip replacement on this list. After all, many seniors undergo successful hip replacement surgery every year. And that's true. For many people, hip replacement can dramatically reduce pain and restore mobility. However, it still carries risks that deserve careful consideration. Hip replacement involves removing damaged portions of the hip joint and replacing them with artificial components. Potential complications include blood clots, infection, joint dislocation, fractures, implant-related problems. Recovery requires commitment. Patients often need physical therapy and rehabilitation to regain strength and movement. One of the biggest concerns for older adults is the risk of falls during recovery. A fall shortly after surgery can create serious complications. Doctors often encourage seniors to prepare their homes before surgery by removing tripping hazards, improving lighting, installing grab bars, arranging assistance when needed. Preparation can make a tremendous difference. Many seniors enjoy excellent outcomes after hip replacement, but understanding the challenges ahead is important. Ask your doctor, am I healthy enough for surgery? What is the expected recovery time? What kind of rehabilitation will I need? What can I do to improve my chances of success? Being proactive can help improve outcomes significantly. Number 1, emergency surgery. The highest risk category isn't necessarily a specific procedure. It's emergency surgery. Why? Because emergency surgeries often happen without the benefit of careful planning and preparation. Examples include emergency bowel surgery, ruptured aneurysm repair, severe trauma surgery, emergency abdominal operations. In planned surgeries, doctors have time to evaluate health conditions, adjust medications, optimize nutrition, and address potential problems beforehand. In emergencies, there may be little or no time for these preparations. As a result, risks can increase substantially. Older adults facing emergency surgery may be more vulnerable to heart complications, lung complications, infection, delirium. Extended recovery times. Another challenge is that emergencies often occur when patients are already critically ill. This can make treatment more complicated. While emergency surgery can absolutely save lives, it highlights the importance of preventive healthcare. Regular checkups, managing chronic conditions, and addressing symptoms early may help reduce the likelihood of certain emergency situations. Of course, not all emergencies can be prevented. But maintaining overall health may improve your body's ability to handle unexpected medical events. How to reduce surgical risks after 60. Now that we've discussed these higher risk surgeries, let's focus on something positive. What can you do to improve your chances of a successful outcome? Here are several strategies many doctors recommend. 1. Get a complete health evaluation before surgery. Make sure your healthcare team understands your complete medical history. This includes medication, supplements, allergies, existing health conditions. Even information that seems minor can be important. 2. Stay physically active when possible. Maintaining strength and mobility before surgery can improve recovery. Some healthcare professionals refer to this as prehabilitation. Simple activities like walking may help improve endurance and overall fitness. 3. Improve nutrition. Good nutrition supports healing. Focus on lean proteins, fruits, vegetables, whole grains, adequate hydration. If you've experienced weight loss or poor appetite, discuss this with your doctor before surgery. 4. Stop smoking. Smoking can impair healing and increase the risk of complications. Even quitting a few weeks before surgery may provide benefits. 5. Follow recovery instructions carefully after surgery. Follow all medical advice regarding medications, activity restrictions, physical therapy, follow-up appointments. These recommendations are designed to support safe healing. 6. Ask questions. Never feel uncomfortable asking questions. A good healthcare team wants you to understand the procedure, risks, benefits, alternatives, recovery expectations. The more informed you are, the more confident you'll feel. Growing older doesn't automatically mean surgery is too dangerous. In fact, many seniors undergo successful procedures every day and enjoy improved health, mobility, and quality of life afterward. The goal isn't to fear surgery. The goal is to understand it. Knowledge helps you make better decisions. The 5 categories we discussed today: spinal fusion surgery, major abdominal surgery, heart bypass surgery, hip replacement surgery, and emergency surgery, can carry higher risks for older adults, but every situation is unique. Your age is only one factor. Overall health, fitness level, medical history, and the expertise of your healthcare team all play important roles. If a doctor recommends surgery, don't be afraid to ask questions, seek a second opinion when appropriate, and take an active role in your healthcare decisions. Remember, informed patients are empowered patients. If you found this video helpful, please give it a thumbs up, subscribe to Healthy After 60, and turn on notifications so you never miss our latest senior health tips. Thank you for watching. Stay healthy, stay informed, and we'll see you in the next video.